Just as everyone is joining, I will hand over to our speakers to introduce themselves. So Kirsty, I'll hand over to you first.
Thanks, Rachel. That's really kind of you. Great to be here. We're quite excited about today here with Pauline. So as Rachel said, my name's Kirsty Pate and I'm a programme lead. I work in the Office of the Chief Social Work Advisor at Scottish Government. I lead on a programme called the Trauma Responsive Social Work Services Programme. And I'm going to tell you a little bit about that as part of our presentation. So I'll maybe just pause and invite Pauline just to introduce herself as well. Thanks.
Thanks, Kirsty. Good afternoon. I'm Pauline Cochrane. So I'm a Senior Manager for Children and Justice Services in West Lothian Council. And I also was the Trauma Champion in West Lothian, or still am, and have been for about 2.5 years. So it's really nice to see everybody.
Okay, I'm going to just get us started by telling you a little bit about what we're going to hopefully cover over the next hour together. We won't be talking at you for that whole hour, hopefully. There should be plenty of time for a conversation and some questions towards the end of the session. So Pauline and I are going to talk to you a little bit about what the Trauma Responsive Social Work Services Programme is and how we have used the roadmap for creating trauma-informed and responsive change guidance throughout a piece of work with West Lothian children and families. We'll talk about some of the challenges in that work and we'll talk about some of the benefits, and hopefully we'll hear from Pauline at the end, just generally a bit of a kind of reflection and summary as to what we've done together and what we've learned from that along the way. So those are the kind of things that we were going to talk about today. So hopefully that is the webinar that you have joined. Okay, so just a little bit of background context. Some of you might be familiar with the programme and others not so much. So the programme of work is part of the National Trauma Transformation Programme, and the Office of the Chief Social Work Advisor at Scottish Government prioritised a focus on how the National Trauma Transformation Programme applies to the work of social workers as a profession, but also of social work services. And we've developed, as part of our work together, a programme of training and implementation support. We invited Chief Social Work Officers across Scotland to apply for the implementation support and training, and the programme's been developed in line with national guidelines, including best practice guidance, and these relate to things like the knowledge and skills framework, as well as other guidance that relates to mental health and well-being of children and young people. So we've developed a programme of around about 15 learning courses with implementation support that cuts across trauma-informed level, trauma-skilled and trauma-enhanced practice. And these are practice levels that people might be familiar with from the knowledge and skills framework. Our programme is offered to social work services and multidisciplinary colleagues, and it's got a real focus on leaders and managers as well as the wider workforce. The programme of support that we offer targets some courses towards leaders, others towards frontline staff, and some are for both. And we're currently working in 4 locations in Scotland. Pauline's here from West Lothian, and we're going to talk to you about how we used the roadmap for creating trauma-informed and responsive change within children's services there. But just for context, our team are working in other practice areas. We were keen when we piloted to test this out in different types of geographical and rural areas. So we're also working within Stirling Council in Justice and Children's Services. We're working in Scottish Borders, and we're also working in the city in Glasgow in adult services. So that's just a little bit of background context to the Trauma Responsive Social Work Services Programme, and West Lothian were one of our first selected sites. So why are we here talking about the roadmap? Some of you may be quite familiar with this and others maybe not so much. So just a little bit of an introduction to the guidance that is for organisations, systems and workforces in Scotland. So this resource was developed as part of the National Trauma Transformation Programme, and it provides organisations with research and evidence about best practice in this area, not just from Scotland but from a whole range of different literature. and it also was heavily informed by people with lived experience of psychological trauma and care. There's two parts to the guidance, and we've used it quite distinctively in the work. You'll hear from Pauline and I about that today. The first part really does give us an opportunity to look at what the research and the evidence tells us. What does good look like? What does it look like when organisations and systems are truly informed and responsive in relation to psychological trauma and the impact that has, not only on people who use services, but for those who work within them as well. And then in part two, we've got lots of helpful resources. So that includes tools to help us do self-assessment in terms of our systems and our approaches, as well as our policies and our environments, and a range of other tools that we'll just introduce to you in the session today. That's a little bit of overview of the roadmap, and that was really one of the key things we wanted to talk to you about. We know that in the early applications for Bairns Hoose support, we made reference to the guidance, the roadmap. Somebody's just commenting that they can't see the slides. I don't know if that's something that everybody's experiencing or if it's just one participant, Rachel, so I'm not sure if you could pick up on that for me.
I can see them okay,
anything.
but if people just want to pop the thumbs up, maybe if they can see it.
Well, I can see lots of thumbs, so that's really positive. I'm not talking into a void, so apologies to the participant who can't see. I don't know if you want to try and maybe rejoin. That's as far as my IT advice and guidance can go, I'm afraid. Sorry, I don't know if Rachel can do anything.
I would suggest join and rejoin, and that would work, I think.
Thanks, Rachel. Okay, so really just trying to demonstrate here that there's clear alignment across the work of the Bairns Hoose standards and the work of the roadmap. The distinct difference, I think, with the roadmap is it's very generalised. So the roadmap can apply to all sorts of different systems, organisations and workforces, not only those that are related to the provision of care and protection. So the guidance can be used in a whole range of different environments across not only Scotland, but other areas, and it has actually been picked up across the UK as a tool that people have found particularly helpful in health and in social care. So let's talk a little bit about the work that we've done with West Lothian just before I hand over to Pauline. As I indicated, the programme of support that we've developed, we estimate that we'll provide support around about 18 months to 2 years to a local area. And the roadmap is quite central to the learning materials that we've developed, but also the overall programme has been informed by a lot of the research and the evidence that's detailed in the guidance. We started working with Pauline and her team back in February 2024, with a lot of kind of emphasis on creating the right conditions for transformational change. So the approach was very much about more than training and more than thinking about sort of physical environments. These are all really important things, but for us it was crucial that we looked into the kind of research and evidence that guided us towards how we sustain systematic change over time. And that really directed us to this longer term piece of work, starting with leadership and culture. So round about May 2024, we started quite an extensive programme of support and learning with the leaders in Pauline's Children and Families Social Policy area in West Lothian. The work's been carrying on since, and this is just a kind of simple diagram really just to help us understand a bit of the journey. We would anticipate being around for at least kind of 2 years, and we will, the work will be subject to evaluation, but the roadmap's been part of the work from early February 2024, and what we're going to do here is just give you some examples of the ways in which that we've used them, and then you'll hear from Pauline particularly about the experiences of her leaders and workforce and how they've found using the roadmap to make systematic change across a range of different teams and services. So we've been working together for around 16 months now. But what I'll do is I'll hand over to Pauline just to give you a little bit more of the context that was happening in West Lothian when we picked up this pilot work back in February 2024. Thanks, Pauline.
Thanks very much, Kirsty. So I am going to take you through a little bit of the local context. So I'm just going to move on to the next slide. So within West Lothian, we already had an established trauma board in advance applying to be part of the pilot. So there was some existing knowledge of the roadmap and the infrastructure, and there was a commitment and a buy-in for systems change locally. And everybody was on board in making the application to be part of the pilot. We'd already began to roll out the STILT leadership training. So that had been out across the leaders across the authority, including senior leaders within social policy, including myself, and some of our elected members. And we'd been providing regular updates to our council leaders. There was training inputs happening, and these are continuing to happen across the council, and you'll see I've put some of the stats up on the slide from 2024, just to let you see the various rollouts that are happening with trauma training. There was trauma network events that we put into place. They attracted about 60 delegates per event, predominantly from social policy, housing, health, education and third sector social care providers, but they were very well received, and the roadmap had been introduced in that space. We'd also began work on looking at some of our policies, particularly our social policy supervision policy, and we then began to incorporate that work into the pilot. So in terms of the pilot locally, what did that look like? We had lots of back and forward, as Kirsty says, some of those early discussions. There was a lot of discussions amongst the senior managers and the group managers for the services around who we wanted in scope, which is quite a challenge because we wanted everybody in scope, but obviously we did have some limitations around that. So we felt it would be best to go with the services that could hold the most impact and show the most systems change. So we really went with our childcare and protection teams right across the journey. So the vast majority were not the regulated services, so it was all the childcare and protection services. So our residential houses, our family-based care and our domestic and sexual assault teams were out of scope, but we have worked to bring them in now. We have had an input in our family-based care and an alternative caregivers trauma input, which has been really well received. And within the domestic and sexual assault team, we've been working really closely with Safe and Together, and we've got some trainer for trainers within that space, which really closely aligns and is definitely part of the 9 aspects of the roadmap. It was also very closely aligned to our SCIM model, obviously, which is part of the Bairns Hoose as well. So within West Lothian, we already had trained workers in SCIM, really from about 2021, so quite a bit before the pilot began. But I think it was about 2023 before all of our interviews were done exclusively using the SCIM model. We don't have a dedicated SCIM team in West Lothian, but we do have dedicated workers who almost exclusively work undertaking SCIMs. They are part of the duty and child protection team, but they're protected. They're protected in the SCIM space. That team has got 3 managers who are all trained to conduct SCIM briefings. There is one manager who takes the lead on managing the workers, attending the national meetings and ensuring involvement in the robust training. And that really links in with the work that we're doing in the pilot and the roadmap. We do have a trained backup worker who we refer to as a resilience worker, really just to cover, your holidays, sickness, etc. When the SCIM is agreed to be undertaken, all the staff are then co-located in the Civic Centre, which is our main headquarters for all our workers. And I have added some data in there at the bottom of the slide just to give you an understanding of some of the scale of the SCIMs that are taking place. Connecting that into West Lothian Bairns Hoose, so we received funding in August 24 and the service was launched in October. We were able to get a coordinator in post really, really quickly from Children's First because we had a pre-existing relationship with Children's First. They've worked a lot in our local authority area. They deliver our family group decision making. So we had a really good level of established communication, relationships and work with them. So they were able to get on board really quickly. They then appointed 2 recovery workers and they came on board in October. We've had a lot of work done with the Bairns House team, the SCIM team, the wider social work teams, school nursing, the Scottish Children's Reporters Administration, Crown Office, Procurator Fiscal Service, Police, Health, Education. So partnership's been really, really key to some of this work. In terms of the Bairns House model, we haven't been successful in identifying a dedicated space, a Bairns House space. That hasn't happened in West Lothian, and I don't think we're alone in that across the other local authority areas. But the thinking and planning has been supporting a change in how we do things and what we could do, and all the partners being in the same space are very much focused on trauma recovery. We held 7 creative workshops with primary and high school pupils to look at planning and preparation, to get an understanding of how that would maximise feelings of safety and avoid re-traumatisation. All of the interviews take place in the Jasmine Suite in the Civic Centre. So that is a police-led space and it is currently used by both adults and children. So it is definitely not without its challenges. The participants of the workshop did then create a newsletter of their journey and they've shared that far and wide, and we've used the content and the feedback to refurbish the Jasmine Suite and make it a much more child-friendly space. But because it's a shared adult and children's space, there's only so far we can really go with that. Coming back into the pilot then, in terms of the workforce and scope, this is just some of the numbers to give you an understanding of the scale. There was a range of experience in the workforce and the leaders that have been involved and are still involved. It has included senior managers, team managers, social workers, family support workers, and definitely our partners have been very much supportive. There's lots of significant years of practice and social work experience in amongst all those staff and groups. We did a very interesting exercise with the Trauma Responsive Social Work Service where we counted who we were, so that was quite interesting, the numbers of years of experience that we've got. I've put at the bottom there just the numbers of people that we support to try and give you a scale of the impact that this pilot has the potential, the people that we are actually working with. I'm going to now hand you back over to Kirsty.
Thanks, Pauline. Okay. Hopefully that's helpful kind of context and background to how we came to come together. And I suppose one of the things that really struck our team was that how much of kind of strategic work had already been happening in West Lothian in terms of being a trauma-informed and responsive organisation in collaboration with partners. So very mindful that we weren't starting something new. There had already been quite a lot of strategic system-wide thinking about what it means to be a trauma-informed organisation and workforce. Where we started work specifically was within that kind of children and families social work space, particularly across the different range of child protection teams and services, including the kind of out of hours and duty intake teams. But thinking back to the use of the roadmap, particularly when we started working with Pauline and her colleagues, her team of leaders there, we really were using the roadmap to help us to think about creating the right conditions specifically across those teams and services and those systems. So taking time to help us understand the current work that was already going on, what was already happening in the organisation and what some of the challenges were. So we used it to facilitate sessions, and we're just going to give some examples of some of the early leadership work that we did using the roadmap to help, as I say, create those kind of conditions. So this was across not only strategic managers, this was bringing us down towards kind of group managers and lots of team leaders as well. So we used the whole leadership group coming together in person over the first 4 sessions to introduce the roadmap detail to the leaders of this pilot project. And it was interesting just having dialogue and conversation with a really experienced and really quite varied and mixed leadership team in social work. We talked quite a lot about things that you might assume that there's joint shared language and understanding around, but really kind of getting into a lot of detail about what do we mean in terms of psychological trauma, what are those distinct definitions, given the sort of appropriation and misappropriation of psychological trauma language and kind of day-to-day use at the moment. It was really important that as a leadership team and group, we helped them to think about some of the kind of key concepts that are distinctly about trauma-informed system change rather than trauma treatment and reactions such as post-traumatic and more complex post-traumatic stress reactions. So really kind of helping people to start to think about and understand some of the distinct language that's at play when we start to think about transformational system change that relates to the impacts of psychological trauma. We introduced the roadmap in the very first session and really early on got leaders thinking about what does the research and the evidence tell us? Where do we need to focus our time and attention over the next 2 years together if we want to see transformational change that can spread and be sustained over time? That brought us to think about culture, leadership and well-being at the forefront of this work together, and we really dug deep into part 1 of the roadmap in order to do this work together. In our second leadership session together, so this was a full day that we spent together, we really took our kind of conversation to a more enhanced trauma knowledge level. People fed back really positively about this, and we started to look in more detail about that kind of research and evidence, not only about the impacts of psychological trauma on people who use our services, but more specifically on our workforce. We spent some time thinking about how organisational culture and leadership are impacting on not only those who are kind of working on services, but the way that we operate and therefore the way that we can affect outcomes positively for children and adults who are using our services. So quite early on, we started to think about models like the window of tolerance, how that affected the organisation, but also how it affected individual leaders. We'll come on and show you a couple of slides that are just some examples of some of the tools that we used from the roadmap to do that work together. Excuse me. Our early focus here was very much on culture and leadership. So thinking about the impact that our organisations can have if we're seeking to make organisational change at a trauma-enhanced practice level. And these were some of the exercises that we did in the room with the leadership team. I suppose really thinking about what people's role was and what their role was in terms of influence between these two factors of culture and leadership. This is a direct lift from the roadmap. We're just sharing it here today as one example of what the research and the evidence tells us things look and feel like where we have trauma-informed leadership. And again, we just did some exercises with leaders together, just lifting material out of that roadmap, and self-reflective individual tasks as well as group tasks where people were looking at the key indicators of trauma-informed leadership, thinking themselves, how am I doing this already? There's lots of good practice, but also where can I add more? Where can I make change and make improvements? We then asked people to think together about the impact of individual and collective leadership on culture. And where that led us to was an exercise collectively where the group together did some readiness assessment. So this is quite a short, brief assessment. It took about an hour and a half. And people started to really think about what's already going on locally that supports this work before thinking about the existing kind of governance arrangement. So these areas hadn't really been thought about right across all of the children and families practice areas that we were bringing together within scope, although they had been thought about at a more strategic level. So really helping this group of leaders come together and to think, what are we aiming to achieve here? What are our shared aims for this work? This is just an example of some of the work that we did together. So children and families leads collectively agreed that they were engaging in a bespoke programme, and I think somebody might have their microphone off, sorry. Helping them to think about their priorities and their plans, helping them to think about their workforce competence and trauma responsive practice, as well as developing approaches that support and promote workforce wellbeing. Workforce wellbeing was absolutely key to this. One of the other shared aims of the work was to improve experiences and outcomes of people in contact with services, which kind of speaks for itself. Okay. This is just another example of some of the work that we did together in our 4th session, drawing directly from the roadmap. So part 2 of the roadmap is a fairly extensive baseline self-assessment, and it cuts right across these 9 areas of focus. So the leaders sat together and we facilitated a session for them, and they kind of scored themselves in terms of the self-assessment, and then they did some kind of RAG scoring to help them come up with what were their local priorities, and these were the local priorities that the leadership group came up with. This is just to reflect where we are now. So you'll see on this slide that says 3 introductory sessions for leaders in baseline self-assessment. So that's the work that I've just described to you. Because of the priorities that were identified locally, our early focus has been on the well-being of the workforce and how leaders can support that well-being. We've also had some sessions relating to power sharing with experts by experience that have been facilitated, and again, very much linking to the local priorities. And more recently, the leaders have undertaken some new learning in relation to skills for professional supervision in order to support the workforce. So we're kind of partway through that journey. I'm going to hand back to Pauline at this point.
Thanks very much, Kirsty. So I'm just going to take us through some of the challenges and benefits that we've experienced as a team. Whilst we were a very experienced audience and we've heard some of that local context around, we were in some quite trauma-informed spaces, we hadn't had an opportunity prior to the pilot to come together as a group in that way. So we weren't all starting from the same baseline of understanding. We weren't all working and operating in the same way across the system. We didn't all have shared language. So it was really important for us to get the space to do some of that. In terms of using the roadmap, while some people were familiar, other people were not so familiar with the concept. So understanding its relevance and its application was, everybody had to start that journey together and come to the same place. It did feel, I think, a bit abstract to begin with. I think it's important to acknowledge that external facilitation was really beneficial, and I do appreciate that that's something that not everybody will have, but there was something about being able to bring us all together and externally facilitate and get us on a baseline that really helped the teams to navigate the roadmap and create a workable action plan. So all out of the work, we obviously had to have some kind of measurable plan. That has also been quite challenging. It's been quite challenging to find a good tool. It's been quite overwhelming. There's a lot of work. So being able to chunk it up and not get caught up in the very, very end, being able to break it into short, medium and long term. There's been a lot of work to just bring people on that journey and help people not to feel completely overwhelmed and anxious. I think we would acknowledge there's a long way to go. We definitely need to just take it a step at a time. But the teams involved did like that the roadmap gave a structured framework for them. They found it a good tool for visualising the journey. They did get a bit caught up in the fact that it wasn't a straight line, but they were still able to get a bit of visualisation from the roadmap, and they could see there was flexibility in its application. There's been a conscious intent, I think, throughout from the trauma responsive social work team to consistently link all the work back to the roadmap, and the team felt that was impactful for them, and they did highlight that was a real benefit to just continuously bring it back and make it a familiar concept, to just share that language, and so everybody's speaking in the same way and understanding the journey through the same lens. I can't underestimate, I think, that shared language and framework and people being able to link the work that was already happening locally with the work that was already to happen, and it could all go in the framework of the roadmap, so people could see what was happening, what was going to happen immediately next, and what was still to come somewhere down the road. It's obviously been developed alongside the Bairns Hoose standards, so you can see the linkages between the two as well. And I think it really assisted in understanding the timeline for change, and that it wouldn't be a quick process. I think some of our team were really and coming from an absolute appetite to embed trauma-informed practice and be trauma responsive, but probably trying to get to the end goal before we had actually started to put the infrastructure in place and have everybody coming for a shared space. I think Kirsty was going to come in here as well and talk a little bit about the feedback from the roadmap sessions, Kirsty, because I know it's coming back to me after, so I don't know if you want to talk first and then I'll...
Yeah, I suppose it was just another helpful look. We wanted to look back at what people's experiences were and reflections at the time. So this is a little bit out of date now, but the stuff that Pauline's just shared with you was from a very recent conversation. So we really wanted to check what were leaders saying at the time in terms of what was challenging or what was helpful in using the roadmap, and then what are people saying about it now, a good few months down the road. So yeah, these are just some reflections from people that, in terms of the kind of initial sessions where we introduced the roadmaps, that for a lot of people there was new learning about trauma and different types of trauma that can affect service users and employees. Space and time, just you can imagine in terms of operational stretch, having the opportunity just to reflect with other managers and colleagues about practice and expectations. Really important messaging around reinforcing existing knowledges as well as new learning. This isn't all new to people. People were already on their journey. And it was quite a broad piece. We're talking about a lot of different aspects of trauma-informed system change.
Thanks very much. So in terms of some of the reflections and experiences then specifically around the roadmap and the baseline assessment that we undertook, facilitated by the trauma responsive social work team, directly before coming here today, because I wanted to get really up-to-date experience, I did speak to one of your group managers and 5 team managers to get some of their feedback. Some of it I've already shared in the wider group, so that was reflected within the wider group. But there was some more specific feedback that they provided. They did feel that the roadmap for new people coming in, so they've had staff turnover, as always happens in social work teams, and they felt some kind of guidance note to sit behind the roadmap would be really beneficial to help people to understand its purpose and its use. They really got a lot out of being able to see where they were on the roadmap at that particular session. So throughout all the different wellbeing sessions and everything else that we've all been part of, the trauma responsive social work team have been really, clear about putting the roadmap up and being able to circle the bit that this is what we're working on today. And I think it just felt like they could see where they were on the journey all the time. So that was extremely beneficial to them. They did want to know where the other practitioners were on the journey. So they're not all doing it all at exactly the same space. So we started with leaders, we did the wellbeing for leaders. So the practitioners are getting inputs at different points. And I think they felt it would be good to see the comparison of where people were on that roadmap journey. As I had highlighted already, we had to continuously remind people that this isn't a straight line, that the roadmap does go, you will bounce between different parts of it and you'll work on different bits at different times. We had a power sharing input that was really impactful, but that is at a different point of the journey. So it was really good for them to be able to see that it didn't go completely in a straight line. In terms of the baseline self-assessment, I think that was a really beneficial process and really important to do as a full team, because then people got the opportunity to, have a conversation. It really opened up what our organisation looks like through the lens of everybody in that room. I got a lot of surprising bits actually to take away as a senior manager, and we've continued those conversations throughout. I think probably important for me to give a little bit more time for some of that reflective content, and I'm going to be trying to do that more as we go through the programme. But there's definitely something about coming together as a full team and having the safety, the facilitation to be able to really get into the nuts and bolts of how your organisation operates and the impact on the people that use your organisations and the impact on us as workers, and how we impact on each other with the peer support and the supervision, etc. So I think it's been a really, really beneficial process. I did mention the role of facilitation, and I'm going to pass back to Kirsty initially, but we might both come in because it's been quite an important topic for us in West Lothian.
Thanks, Pauline. Wasn't excuse me, sure about whether it was helpful for me to kind of comment on the role of facilitation, but Pauline convinced me that it was okay. I suppose from a team's perspective, from our team's perspective as the facilitators, one of the key things for us was becoming quite familiar with the content and the detail, and just a recognition that it's a fairly extensive document. So it was important that all of the team who were involved in facilitation became really kind of familiar with that. We then provided that kind of clarity of shared language and understanding around the kind of research and the evidence base. And I suppose one of the things that became quite key that our team learned as we went along was we weren't quite sure what the distinct role of us all being registered social workers would be in our facilitation, because the roadmap is quite a general tool, but what became quite apparent throughout its use was our I suppose just that experience that we had to be able to pull out some of those quite unique and distinct challenges and barriers about implementing this work within a social work context. And just on the other side of the slide there, I've popped up some of the feedback that we got around facilitation. Pauline, I'm not sure if there was anything else you wanted to pick up on this one.
I think it's just I think facilitation can be thought about in lots of different ways. I think it's just important to have somebody within the organisation that's maybe slightly sitting out of the whole, being party drawn up the plan necessarily. There was something about safety and permission and the ability to be honest that came with the facilitation of the roadmap and the baseline assessment that really was impactful. But yeah, I think we can think about it creatively. It doesn't always necessarily have to be an external person coming in, but there was something really, really valuable about that. We had an experience within the trauma board doing a bit of test for change, where we had tried to do some of that work, but teams went away and did their own baseline assessment, and they all immediately jumped to the walkthroughs that are at the one of the 9 points in the roadmap, and that they were not ready to be at that point. So there was something about being able to slow it down and being able to see all the different parts, that all 9 aspects are really important and they all need to be given the timeline. And I think that's all I would really add.
Thanks, Pauline. And it's interesting because that's kind of shared learning from some of our other sites. Not moving too quickly to making operational changes and changes in buildings and environment, but actually thinking much more about leadership culture and the well-being of the workforce before kind of moving to some of those more practical and very understandable places that we go to when we're thinking about trauma-informed systems. Okay, so just popped up here on the slide a couple of other tools. Pauline made reference there to the kind of walkthrough. There's tools in part 2 of the roadmap that you can use if you want to take that work. Our suggestion is you need to do some of the earlier work perhaps before kind of going to that operational delivery aspect of the work. And there's an example there of how you might undertake a trauma-informed lens review to some of your policies and your processes. So just really kind of highlighting some of the other tools that are there within the roadmap. Pauline, I think you were going to finish us up on final reflections and thoughts.
Thank you very much, Kirsty. So I suppose the thing I would stress is to be patient. I think it is definitely a marathon and not a sprint. I think it's been quite amazing to watch the changes, even the small ones that we've had locally, and the language that's creeped in right across the organisation. People will regularly tell me now as their senior manager, nope, I have hit my window of tolerance, and they'll talk in those terms, and it's really helpful because we then all get it and we're all in the same space. Same within the supervision space. So maybe not always helpful for me as senior manager, but yeah, it's been helpful for the staff group. They really have been given permission to acknowledge the impact on themselves and the impact on others, and that's going to be a process that we all have to go through. I think the visibility leaders in the organisation, myself and my colleague, another senior manager within West Lothian Council, we've been really visible throughout the whole process. We know that there's a lot of pressures on time, and at points we have questioned, oh, do we need to be all of these? But actually, I think universally you do. You have to be there. You have to show the visibility. You have to give the permission. You know, there's a whole system that has to change. You have to create the spaces for connection and reflection. So I don't think that can be underestimated. Despite the pace at frontline practice that we're all dealing with, it's been amazing to see the buy-in for the work, because, you know, our partners externally as well, you know, we've been very well supported by our health colleagues externally. There's been really lots and lots of buy-in for this work, because people really see the value and they're already talking about the changes that's happening. So despite having no resources and despite huge pressures, this work has been really crucial to everybody moving forward. I think I personally have changed a lot through the work as both a leader and a practitioner, and I am definitely thinking differently now about power sharing, about our supports for our workers, and obviously the supports for the people that use our services. So we're definitely still on our journey and probably will always be on a part of the journey, but it's really exciting times and good to see. Thanks.